The issue around hysterectomy options really comes down to two major choices: laparoscopic supracervical hysterectomy or total laparoscopic hysterectomy. When I have patients that need hysterectomies, I start in one bucket. I put all my patients in one bucket, and that's an LSH bucket. And the reason I do that, laparoscopic supracervical hysterectomy, in my opinion, is anatomically the most appropriate procedure for women who have benign uterine disease. And I think the main advantage of a laparoscopic supracervical hysterectomy is patient recovery. There's no cutting in the vagina, there's no changes in the vagina, there's no suturing of the vagina, and there's no healing of the vagina. So patients really incredibly do well in the post-operative or the post-sentinel procedure with LSH. So for me, LSH is a major home run. It's easy technically for me to do. It's a very simple operation. But for the patient, it's a major, major home run and has great benefits. Well, open hysterectomy, or what we know as total abdominal hysterectomy, really in today's world with innovations in procedures is really not an option. There isn't anybody that I take care of, or really anybody I know, whether they're friends or colleagues, that want to be cut open for any operation. So total abdominal hysterectomy should be your very last choice. Two areas that are kind of gray when you talk about supracervical hysterectomy versus total hysterectomy is if we leave the cervix, is there any support benefit or any benefit with sexuality? And if you look at the data, it's inconclusive. It's really hard to prove that leaving the cervix has sexual support function, but we know that in patients who retain the cervix, in their mind, when they think about it, there's been absolutely no change. There's no change in the vagina, there's no cutting in the vagina, there's no suturing or healing of the vagina, and we know that with total hysterectomies, there's complications unique to that operation, such as vaginal cuff eviscerations, vaginal cuff dehiscences. So we can immediately eliminate those complications by leaving the cervix in place. So there's some real benefits to laparoscopic supracervical hysterectomy.